talking about the Oscars last night, but how do the Hollywood stars really look so good? After the break, we are talking with Valley plastic surgeon Dr. Dan Shapiro about celebrity beauty secrets. Last night was the night that Hollywood dreams are made of. The celebrities dazzling along the red carpet for the 89th Academy Awards. And of course, talk about pressure to look good. Everything must be absolutely perfect. And let's be real, they have incredible genetics, but that's not all. They have a glam squad, and often the secret component of that glam squad is a plastic surgeon, whether they admit it or not. This is not just washing your face well and taking off your makeup before bed. So Dr. Dan Shapiro of Shapiro Aesthetic Plastic Surgery and Skin Clinic in Paradise Valley is kind enough to join us this morning before you have a surgery to break down what these celebrities don't want us to know and how we can also prep for maybe what's, an important occasion or just wanting to look our very best. Sure.
I think with Emma Stone, I mean, she's lucky. She's got genetics, and the fact that she grew up here, so she did something right. Probably a lot of sunscreen when she was growing up, and probably didn't go out in the sun a lot. But I think that celebrities have the advantage that they have preparation and they have advice.
Okay.
So a lot of the people that get ready for the awards have started months ago, and they start with they're always hydrating, but they're months ago, probably 2-3 months ago, they start with things like microdermabrasion, soft tissue fillers, Botox, and those things are so popular now because they're all over social media. So they start much younger. You look at Kylie Jenner or Kim Kardashian with the fillers and the lips and the Botox. People are really much more conscious of it and are more apt to do it. I see a lot younger patients in my office now.
Are people going in for Botox even in their 20s?
They are.
They are, okay. They are. Well, we know Emma is young and her skin is glowing, and so obviously some great facials and some great skincare. We want to talk about Nicole Kidman. Nicole Kidman was so stunning, and she is not as young as Emma Stone.
No, she's 49.
She actually looks better now than she did years ago.
And that's interesting because that's kind of like the learning curve of the non-invasive treatments. There are some pictures on the internet before, maybe 3, 4, 5 years ago, where she looked really pretty bizarre and distorted. And I think it's a lot softer look now. I think the Botox and fillers are getting much better, and it always just really depends upon who's doing the Botox and fillers.
Yeah, we've got some video running of her, and she just looks, I mean, she's luminous.
She's beautiful.
And they don't want to have a plastic surgery procedure completely to their face before an event like this, because people are going to be comparing last year to this year. Everything needs to be subtle.
It does, and if they do have surgery, it's months and months before.
Okay.
So I think the general rule is if you have an event, you want to get some of the soft tissue and fillers probably about 3 weeks before, so you don't have things like bruising, and if surgery, 3 to 6 months before.
Okay, so what would you recommend to somebody who is thinking about a big event or just wanting to constantly maintain? What's the most important thing we can do on a regular basis?
I think the most important thing is to get some professional counsel in terms of, get to know an esthetician at an office, get to know the things that we can offer that are non-invasive, and it's just maintenance, just like everything else. You go to the dentist to have your teeth cleaned. I think a lot of people view of what we do now is maintenance therapy.
Okay, and if facials, laser treatments, all of that, that's almost monthly or multiple times a year?
Multiple times a year. And now, that there are so many sophisticated non-invasive skin tightening treatments now that can really put off surgery for years. And I think a lot of the stars now are getting those treatments done. Oh,
no doubt about it. Guys, we are able to show some video here, and I apologize, Doctor.
Sure.
I don't think you can see it very well. But all of the ladies look great. I mean, everything. Halle Berry, let's talk about her specifically.
She's 50, and she's kind of like a genetic freak. She's beautiful.
I interviewed her many years ago, and I was stopped in my tracks because I thought she was even more beautiful in person, and her skin was just dewy and gorgeous.
Well, somebody like that, just don't believe that they don't have things done. So they are on a maintenance plan, and they are, I think, as compared to some of the older stars that you see distortion, like Faye Dunaway last night, really doesn't look like she used to. Granted, she's almost 80, but she was such a beautiful woman when she was younger. And the surgical techniques now are so good that we can maintain that youthfulness without looking distorted. But somebody like Halle Berry gets non-invasive treatments regularly, and I think that she looks so fantastic because she hasn't had bad surgery.
How much does it really make a difference, your lifestyle? I mean, you hear a lot of them say, oh, I eat vegan, I drink a ton of water, or I don't drink alcohol. I don't ever really believe it, but it does make a difference.
Well, I mean, anything in moderation, but genetics are the most most important thing. But you know, sunscreen, don't smoke. Smoking is about the worst thing you can do.
Yes.
And also just a lot of hydration and sunscreen, and it will take you very far, and you stay away from my operating room.
But if we need to go, then we're going to trust him. And of course, you can go to the skin clinic side of the practice and stay out of the operating room. Thank you so much, Doctor. Appreciate your time this morning.